child in America in 1986, by 1 year of age, got 3 injections. Today, it's 29.
Yeah.
Every one of those products was made by a company knowing they weren't going to be liable.
Exactly.
And so what kind of trials would they do? Do they do trials like they do with drugs, long-term placebo-controlled trials? No. With drugs, they do that because they want to not lose money later.
Right.
But vaccines, they don't. So what kind of trials do they do? Well, I lay it out in my book. You've read it.
Yep.
Days, weeks of safety review, no placebo controls, not enough kids in them. And so over the last 40 years, so with that backdrop, over the last 40 years, you've had basically no pushback on this industry. When you read about a problem with a car, it's because there's a big class action lawsuit. So you're like, oh man, there's this issue with this car. There's an issue with this baby product, car seat, or whatever. You're not going to read about that with vaccines.
Sure.
And so for 40 years, the corporations have had basically no pushback. Class action attorneys and product liability attorneys are totally neutered. And then the far weaker way you assure product safety is the federal health agencies. But here they're totally conflicted.
Yeah.
Our federal health agencies promote vaccines and literally defend them in a program called the Vaccine Injury Compensation Program. So they're entirely conflicted when it comes to vaccine safety. So who's minding the ship? What pushback? And like every good business, pharmaceutical companies make sure they promote their product. People like their product.
Yeah.
That's what they do with cars. That's what they do with other products. And they do it through learned, through trusted intermediaries like doctors and so forth. There's nothing conspiratorial about that. It's just economics and conflicts. And so when you understand that, I hope that demystifies it.